study recently released looking at alcohol consumption in Danish women and the effect on their children has a lot of really valid points. What they did was look at children 5 years of age and compare women who had very little alcohol consumption, moderate alcohol consumption, or more of a heavier or binge drinking consumption. And they compared their children for growth and development and IQ. This was a very reassuring study for women who may, for instance, have had a glass of wine with dinner before they even knew they were pregnant. They can feel better about the fact that they can expect their child to develop normally and have normal IQ by the time they reach school age. My concerns with taking that study and comparing that to all women across the board are that it looked at women of a very homogeneous ethnic background. Danish people hold their liquor really well. And if you compare that to people in America who come from such diverse ethnic backgrounds, we have groups of people for whom alcohol is not well tolerated, and you can expect different alcohol concentrations in their blood depending on what they drink. Danish wine also has less alcohol concentration than American alcohol. In our beer and wine, there's a higher percentage of alcohol. So my concern is if you take this study and bring that out to the general population and say, okay, now we know that it's okay to drink alcohol during pregnancy, we really haven't proven that there's any safe amount of alcohol to take, especially if we're looking for fetal alcohol syndrome and related disorders. The study was not designed to look for fetal alcohol syndrome specifically. So my advice for women continues to be, stay away from alcohol while you're pregnant, but don't be concerned if you had a few drinks before you knew